Good evening, friends. Today I'm going to explain the osteology of the scapula. So, how to determine it is a right scapula or left scapula? So, here first you must be knowing the borders. Okay, this is the superior border, this is the medial border, this is the lateral border. How you can identify the lateral border? By the glenoid cavity. This is the glenoid cavity. This border is lateral border. This is medial border, and this is superior border. Now angles, there are three angles. This is this angle between the superior border and medial border is called as superior angle. Between the lateral border and medial border you can see the inferior angle, and this glenoid cavity itself is the lateral angle. Okay, now surface, this is the anterior surface or costal surface, and this is the posterior surface. Okay, now in the posterior surface you can see this spine. From this spine you can determine that it is posterior, that should be backwards. Okay, and this glenoid cavity should be laterally. So which side it is? Here the humerus will come. This is the right scapula, because it should be posterior, spine should be posterior, this should be lateral, glenoid cavity should be lateral. So this is the right scapula. Okay, now coming to the processes, there are three processes. This is called coracoid process. This is anteriorly, you can see coracoid process. Posteriorly you can see spinous process, and this is called acromion process. Okay, three processes are there. Then posteriorly, above the spine you can see here, this is called supraspinous fossa. This is called, below the spine is called infraspinous fossa. Okay, now this spine is there. Now this spine here you can see anteriorly it get attaches to the scapula, there is no gap, you can see here, but posteriorly it is free, and this forms the crest of the spine, which is thick, forms upper lip and lower lip, upper lip and lower lip of crest of spine of scapula. Okay, now coming to the acromion process. Acromion process, it is flat, it contains superior surface, inferior surface, and this is lateral border. As this is glenoid cavity, this is lateral border of scapula, this should be lateral border of the acromion process, this, and this is medial border, this is medial border of the acromion process. Now coming to the coracoid process. Coracoid process, this is the tip of coracoid process, tip of coracoid process, and it contains superior surface and inferior surface. Next, coming to the insertion and origin of the muscles. So coming to the medial side, this is medial side, right? Whether it may be anterior or posterior, medial side is all insertion of muscles, because this is right scapula. If we keep here, this is the spine, vertebral column, all the muscles will come from the spinous too and get inserted to the medial border. So these muscles, medial side muscles, are called as spino-scapular muscles. So from here there are some muscles origin and gets attached to the what, here humerus it attaches. So these other muscles are called scapulohumeral muscles. Okay, now coming to the coastal surface. Coastal surface, here medial border, you get what I said, insertion of only one muscle called as serratus anterior. It originates, it has 8 digits. Okay, this is insertion from the origin, it has 8 digits muscle. The first digit or insertion will be here, next 2 will be here, and next 5 will be here, that is inferior angle. Okay, next 5, this is the insertion of the serratus anterior in the costal surface of the medial border of scapula. Now next, here at center you have, this is somewhat like a fossa depression. This is called subscapular fossa, gives the origin of the subscapular muscle, subscapularis muscle. Okay, now coming to the dorsal surface. Dorsal surface, you can see here, I said this is spine. Above spine, I said supraspinatus fossa gets origin of the supraspinous muscle, and below it is called infraspinous fossa, gets origin of the infraspinatus muscle and supra. This is supraspinatus muscle and this is infraspinatus muscle. Okay. Next, here lateral border, which is lateral border. This is lateral border. Okay. Here you get origin of the, what is this? Teres minor, and this is teres major. This is teres minor. This is teres major. Origin. Next, dorsal surface only, medial border. What you can see? I said medial border, all insertion. Here insertion of, what is this? From the superior angle till the, this is root. Okay, root spine. Till the from the superior angle till the root, you get insertion of levator scapulae, and in the root you get insertion of rhomboides major, and from the root till the inferior angle you get insertion of the rhomboides major. Next, in the spine, in the spinous process only, as I said, this is upper lip and this is lower lip. Upper lip, there is an insertion of trapezius here, which continues by the insertion of here clavicle will come. Here it gets continued. Insertion of trapezius in the upper lip of the spine of scapula, and here lower lip you get origin of the deltoid muscle, and continues till the lateral border of the acromion process. This full is the origin of deltoid muscle. Here lower lip of spine of scapula, lateral border of acromion, and you can also say the anterior surface of lateral 1/3 of the clavicle. Here origin of deltoid. Now next, coming to the coracoid process. Posterior side is over, all insertion and origin. So here in the coracoid process, tip of the coracoid process, there is an origin of the coracobrachialis and short head of biceps brachii. What are two muscles? Coracobrachialis and short head of biceps brachii from the tip of the coracoid process. And this is upper surface, as I said. Here you get the insertion of the pectoralis minor. Pectoralis minor, here superior surface, you get insertion of the pectoralis minor. Here this is origin of the coracobrachialis and short head of biceps brachii. Now coming to the glenoid cavity. Here this glenoid cavity is not full deep, so that the head of the humerus get articulate. So this margin has a fibrocartilage called as glenoid labrum. Okay, this margin has a fibrocartilage, so that the head of the humerus get articulate to the glenoid cavity, called as glenoid labrum. Now above the glenoid cavity, you can see here, above the glenoid cavity you can see a tubercle. This is called supraglenoid tubercle, gives the origin of the long head of biceps brachii, and below the glenoid cavity you can see a tubercle. This is called infraglenoid tubercle, gives origin of the long head of triceps. Okay, this is about the scapula. Thank you. Hope you understood.